Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Vision failure. There are many causes of vision failure. The commonest cause seen in the physician's office is a simple refractive error. Refractive error means that the shape of your eye does not bend light correctly, resulting in a blurred image. The main types of refractive errors are myopia, nearsightedness, hyperopia, farsightedness, and presbyopia, loss of near vision with age, and astigmatism. Astigmatism is a common vision condition that causes blurred vision. It occurs when the cornea, the clear front cover of the eye, is irregularly shaped, or sometimes because of the curvature of the lens inside the eye. Refractive errors can be corrected with eyeglasses, contact lenses, or surgery. Eyeglasses are the simplest and safest way to correct refractive errors. Your eye care professional can prescribe appropriate lenses to correct your refractive error and give you optimal vision. The sudden failure of vision. Virtually all cases of sudden loss of vision require urgent treatment. The only exception might be temporary vision loss associated with migraines. In the West, the commonest causes of vision failure are senile cataracts, glaucoma, age-related macular degeneration, diabetic retinopathy, and trauma. The commonest causes of sudden vision loss are a transient occlusion of the retinal artery, a condition with another fancy name of amaurosis fugax, and migraine. We will discuss amaurosis fugax in a later video on vision failure. History. During the history, the physician will want to determine the onset of the vision loss, the duration, and the extent of the vision loss. The physician will want to determine if the failure is in both eyes. Was the onset sudden, gradual, or progressive? Is the failure of vision in the peripheral fields of view? Is it in the central field of view? What medications are you taking? What recreational drugs, if any, do you take? Have there been dark blobs in your field of vision? Have there been flashing lights in your visual fields? Do you see colored halos around the lights? Have you seen zigzag lines? Is your vision worse at night or in dim light? Have you had a headache? Is there pain when moving your eyes? Do you bump into people or objects frequently? Are you a diabetic? Do you have multiple sclerosis? Do you have heart disease? Have you been exposed to lead in your environment? The physical exam. The physical examination will include testing your vision with eye testing charts to determine vision, testing your color vision, testing your visual fields. Your visual field is the area you can see in front of you without moving your eyes. Using one of three tests, the doctor maps what you see at the edges or the periphery of your visual field. Drops will be placed in the eyes to dilate or make your pupils wider in order to facilitate the examination of the back of your eye. The retina, macula, and optic nerve are in the back of the eye. Whether the eye dilatation during an exam is necessary depends on the reason for your exam, your age, your overall health, and your risk of eye diseases. The eye drops used for dilation cause your pupils to widen, allowing in more light and giving your doctor a better view of the back of your eye. Eye dilation assists your doctor in diagnosing common diseases and conditions, possibly at their earliest stages. They include diabetes, high blood pressure, macular degeneration, retinal detachment, and glaucoma. Then anesthetic drops will be applied to the eyes. If you are at an ophthalmologist or eye doctor's office, he or she will then test your eyes for ocular tension. The ophthalmologist will instruct you to position your head into a device called a slit lamp. Then a puff of air or a small tip gently touches the surface of the eye, and the eye pressure is measured. The eye pressure is measured based on the force required to gently flatten a fixed area of the cornea. The physician will also continue a general physical exam with focus on the nervous, cardiovascular, and endocrine systems. The objectives of the physical examination are to test and record your vision, inspect the eyes under magnification, test the pupils, test ocular tension or pressure. Both eyes must be examined. Investigative tests may be a full blood count to rule out anemia or leukemia, lead levels when considering lead poisoning, a sedimentation rate when temporal arteritis is considered, blood sugar levels if diabetes is considered, imaging to evaluate the possibility of retinal vascular problems or diabetic retinopathy, visual evoked responses to evaluate the possibility of demyelinating disorders, a CT or MRI to evaluate the possibility of a CVA or space-occupying lesion, temporal artery biopsy to rule out temporal arteritis. Well, we will continue our discussion of vision failure in the following videos. I hope this helps. Have a good day.